In urological oncology, where robotic procedures have rapidly become the standard of care, surgery has been revolutionized. In 2019, for example, 92% of radical prostatectomies in the UK were performed with robotic assistance. Before we get started, make sure to hit that like button and also subscribe to my channel. The landscape has been dominated by the Da Vinci surgical system, Intuitive Surgical, but with patents coming to an end, a flurry of novel robotic systems are entering the market from medical and technology firms including Johnson & Johnson, Medtronic and CMR Surgical, among others. Traditionally, surgical robotics has been limited by significant overhead costs, but increased market competition should help to allay this barrier, widening access to the technology. With advances in haptic feedback, machine learning/artificial intelligence, and training, robotics will continue to transform surgery over the coming years. The term robot was first used in 1920 by the author Karel Čapek in his play Rossum's Universal Robots and stems from the Czech word robota, meaning forced work. While robots have been commonplace in industry for some time, the history of robotics in surgery is relatively short. It was only in the 1980s that surgeons began to appreciate the potential benefits of robotic surgical systems. Proposed benefits included increased three-dimensional accuracy, greater precision and finesse, particularly in minimally invasive procedures, and telesurgery. However, for the early innovators in robotic surgery, autonomous surgery was the aim. The Probot, developed by John Wickham, was a device that attempted to perform robotic transurethral resection of the prostate, TURP, using a rotating blade, and was shown to be feasible and safe in early trials. While never implemented more widely, this was one of the earliest examples of a truly automated robotic device in surgery. Focus then shifted from autonomous systems to master/slave technology, with devices such as the Zeus, computer motion, and Da Vinci system aiming to enhance standard laparoscopic surgery by translating actual hand movements. From the late 1990s, Zeus, a three-armed system using a voice-activated camera, was successfully trialled in cardiac and gynecological settings. A transatlantic cholecystectomy was even performed in 2001. However, the merger of Intuitive Surgical and Computer Motion in 2003 meant that future innovations subsequently focused on the Da Vinci system that consisted of four arms, a wrist allowing 7 degrees of freedom, and a binocular lens offering 3D vision. After gaining Food and Drug Administration approval in 2000, 2 decades of market dominance followed for the Da Vinci system. There are now nearly 6,000 Da Vinci systems in operation that have performed 8.5 million procedures worldwide. The UK is home to approximately 115 of these, covering the majority of geographical regions. Globally, the largest proportion of robotic surgery occurs in general surgery and gynecology. In the UK, however, urologists perform more robotic procedures than any other specialty. The need for greater vision, precision, and control in laparoscopic prostatectomy, coupled with prostatectomy being a common and important operation, likely underlies why urologists were able to justify using the £1.7 million Da Vinci robot within the publicly funded NHS. Over 14 million laparoscopic surgeries are still performed globally every year. However, the benefits of robotic surgery are noteworthy in certain procedures. Views in laparoscopic surgery have always presented a challenge to the surgeon, who must make inferences about spatial relationships to mentally transform a two-dimensional image into 3 dimensions. The Da Vinci robots go a long way in addressing this issue. by immersing the surgeon in a 3D operating field using binocular and endoscopic vision with 10 to 15 times magnification. By visualizing surgical planes in greater detail and providing views that are not possible in traditional laparoscopic surgery, robotic surgery has improved surgeons' technical abilities, appreciation of key structures, and patient outcomes, with improved rates of potency in nerve-sparing robotic prostatectomy. Where standard laparoscopy uses instruments with fixed tips, the Da Vinci system employs the endo-wrist system, imitating human wrist and elbow movement to provide a much greater range of motion. Furthermore, the fulcrum effect with laparoscopic surgery, where instrument tips move in the opposite direction to the surgeon's hand, is completely eliminated in robotic surgery. While this may not confer significant benefit to an expert laparoscopist, the intuitive, human-like endo-wrist system is highly advantageous to those trained in open surgery and to surgical trainees. Expanding the scope of robotics in the UK, robotics has predominantly been driven by urology, as certain procedures such as radical prostatectomy and partial nephrectomy lend themselves to the intricacies of robotic instrumentation. These procedures have become highly efficient with excellent outcomes, so future gains from improving surgical robotics are likely to be had outside of this field in areas such as ear, nose and throat and thoracic surgery, alongside gynecology and general surgery. Robotic use in these specialties is already increasing rapidly, and improvements in commercial viability and accessibility will promote the translation of the current robotic surgical systems into a much wider range of procedures. Novel robotic systems. The 20-year reign of the Da Vinci surgical system is approaching an end with the recent expiration of its patent. Many well-established companies and smaller startups have brought to the surface novel systems with unique selling points that aim to displace the market domination held for over 2 decades by Intuitive Surgical, manufacturer of the Da Vinci system. Approaches and features vary from the introduction of haptic feedback, single-port operating, to the implementation of artificial intelligence. In contrast to the Da Vinci system, the arms of Versius are lightweight and provide ease of transport and deployment. The versatility of Versius, with the ability to add and remove arm carts, makes it a more practical portable solution. The open console provides an ergonomic position and uses 3D glasses, facilitating team communication, a limitation of closed consoles. The portability and ease of use of this system will likely make it one of the main competitors to the Da Vinci system. Versius systems have already been installed in hospitals in Germany, Australia and the UK as of June 2021. Otava remains in development but will consist of 6 robotic arms integrated into the operating table. The design provides a zero-footprint device that frees up space and enables better patient access, although it is unclear how clashes will be avoided if all 6 arms are in use. Ethicon's establishment in the medtech industry provides the backbone to this new system and will allow integration with their energy and laparoscopic devices. Johnson & Johnson are well equipped to further explore minimally invasive and endoscopic robotics, aiming to extend Otava's utility to catheter-based vascular interventions. Furthermore, with machine learning integration, the system will aim to utilize artificial intelligence-assisted surgery to reduce error, facilitate training, and aid research outputs. Thank you so much for watching this video. Please do let us know what you think. Any feedback is welcome in the comments below. And don't forget to hit that like button and subscribe to our channel.